We usually get referrals from pediatricians about children who have had recurring ear infections, and most of the time that's in the wintertime and kids who usually are in like daycare. And so we usually see these patients after they've been diagnosed with at least 3 or 4 ear infections, and the services that we provide are to take that next step in treatment. And usually what that is to provide ear tubes or other treatment, not just antibiotic treatment for these children. And it's not just ear infections. A lot of the issues that come from the ear infections actually start, with nasal congestion, runny nose, allergies, stuff like that. So we also help provide some management for those conditions as well. In order to get these kids healthy, get them so that they're not always going to the pediatrician's office, 2 or 3 times a week, and they can get them back to daycare and get them back with their friends and stuff like that. Another very common issue that we see, especially during the summertime, is swimmer's ear, or the medical term is called otitis externa, and that's usually when the kids have been going to the pool or going to the river or to the lake or to the beach, and they come back about 2 or 3 days later and they have very extreme ear pains. They may have actual drainage from the ear as well. And so in terms of when we usually see these patients is if they've been to an urgent care facility, or if they've been to their pediatrician and they just have these persistent symptoms even after they've tried oral antibiotics or ear drops. We see them in clinic and we help to clean the ears out, and we can provide some topical medication as well in the clinic. But to talk about these ear infections, one of the things that we can, hopefully help to prevent the ear infections is just to try and keep the ears as dry as possible after they get out of the pool or after they go to the beach. And so that includes, just taking a little washcloth and cleaning out the ears from the ear canal. You can also try the over-the-counter swimmer's ears, the ear drops as well. And another thing is to use, sometimes you can use like a hair dryer or something like that to also help keep those ears clean just for a couple of minutes after they get out of the pool, just to keep that moisture from the ear canals.